we will discuss the very important remedy, the Apis mellifica, the honeybee. So, Dr. Phatak gives a clear-cut directions about the remedy Apis mellifica. The well-known effects of bee sting are the guide you to this remedy: burning, stinging, smarting, pricking, rapid swelling. This is not a slow remedy, it is a rapid, acute, sudden remedy. It acts mainly on the cellular tissue, serous membrane, mucous membrane. When there is edema, effusion, inflammatory swelling, red, rosy, shiny appearance, think of Apis. So, clinically, this is one of the most important remedies in acute inflammatory stage, allergic condition, oedematous condition, renal involvement, meningitis picture, ovarian inflammation. So, Apis, the central theme of Apis is heat, swelling, sensitivity and irritation. Heat, swelling, sensitivity and irritation. So, physically and mentally, Apis patient reacts quickly, overreacts. Inflammation is sudden, pain is sudden, emotion is sudden. So, these patients are irritable, restless, jealous, sensitive to touch and heat. And what is interesting that they are thirstless even in fever. The thirstlessness is very important in the Apis. So, an inflammation that cannot tolerate heat, either physical or emotional heat. Mentally, Phatak gives a beautiful symptoms that jealousy. This is a very important jealousy, especially in women with suspiciousness. Suspicious, foolishly suspicious. Fussy, hard to please, nothing satisfies them. Everything feels wrong. Tearfulness, they cry without reason. This is not a igneous silent grief, this is a restless crying. Cannot bear to be alone. They want company, especially during fever and illnesses. The child holds mother tightly. Sexual mania alternating with stupor. Important in women with suppressed menses. Excitable phase followed by dullness. So, promotion of the death, very important in acute cases. The patient may say that, doctor, I will not survive, especially in respiratory distress. Indifference, sometimes they say that nothing is wrong even the condition is serious. This contrast is interesting. In physical, general symptoms are very important. Now, thermal state, aggravation from heat, aggravation from warm room, warm drink, warm bath, warm of the bed. Better in cold air, cold application, uncovering. This is not a negotiable in this remedy. Patient loves, if patient loves warmth or heat, the Apis should not be prescribed. Thirstlessness, even in fever, even in dropsy, is the keynote. Aggravation from lying, after sleep, 4 p.m., better in sitting, erect and motion. Rapid onset is the key for Apis. Symptoms develop rapidly, sudden pains, escorts cries, sudden shrill cry in hydrocephalus, very important pediatric keynote. Prostration, great debility, feels as if worked hard but restless at some time. This combination is characteristic. Extreme sensitivity to touch, even touch to the hair is unbearable. So, the patient throws away the blanket, bags of the cold air, Apis is already standing in your prescription pad. So, in general pathological sphere, Apis acts mainly on the serous membrane leading to effusion, kidneys to albuminuria, brain to meningitis, ovaries to inflammation, larynx to edema, skin to urticaria and erysipelas. This is the whole understanding of the pathology of the Apis lies in 5 to 6 lines. In the serous membrane, it causes effusion. In the kidney causes albuminuria. In the brain it causes meningitis, and in ovaries it causes inflammation. In larynx edema, and in skin urticaria and erysipelas. So swelling, fluid accumulation, redness, burning, stinging pain, think of Apis. In head symptoms, the main pathological prescribing point is in meningitis and hydrocephalus. A characteristic picture of Apis, you may see that sudden grade of high fever, sharp shrill cries, rolling head from side to side, boring head into the pillow, cannot hold the head. So Phatak clearly mentions that sudden shrill cry in hydrocephalus and meningitis. This is a big keynote. The cry is piercing, almost like something is stabbing inside her head. So, sudden stabbing in head, as if a blow, numb, tired headache, better by pressure, brain feels very tired. A child may scream and then become dull. Fontanelles may sunken. In modality, vertigo, aggravation closing eyes, aggravation on lying down as in general, flows of tears with headache. So, Apis brain inflammation is accompanied by edema, inflammation, effusion and then shrill of cry. The clinical correlation is meningitis, encephalitic state, post-viral brain edema, rise in intracranial pressure, suspicion. We are not claiming the cure, but remedy recognition is powerful. So, in eye symptoms, water bags eyelids. So, this is the key of upper eyelid is swollen, lower eyelid is like a bag, red conjunctiva, hot tears. Phatak clearly mentions that puffy lids, oedematous water bags, red chemosed eyes, burning stinging pain, photophobia, covering intolerable. So, photophobia but cannot tolerate covering. So, this is the contradiction in the symptoms, but this is good. Key prescribing point: eyelids are swollen, red, shiny, burning, and patient wants to cold application. In throat condition, tonsils swollen, fiery red with stinging, uvula edematous, swelling painful, aggravation from solids, better by cold drinks. Better by cold drinks is very important key for Apis prescription. Phatak mentions that diphtheria with early prostration, dry membrane, edematous uvula. So also look, throat is glossy, translucent and shiny. That shiny edematous look is signature of Apis, and also you may compare it with Elianthus. So clinically acute tonsillitis, peritonsillar edema, diphtheric picture, angioneurotic edema, laryngeal edema with air hunger, think of Apis. In respiratory symptoms, air hunger with edema. Now, Apis respiratory distress is serious. Patient says that doctor, every breath of my feels like my last beat. Patient breathing, air hunger, edema of the larynx, burning, stinging pains in the chest, hydrothorax after pleurisy, asthma from hives, asthma after urticaria is suppressed. So, suppressed eruption leads to Apis pathology. So, clinically in acute laryngeal edema, allergic asthma, pleural effusion, post-infectious pleural accumulation is the key pointer to the Apis. The patient throws away the blanket, wants air, thirstless. Apis suffocates in the heat, whereas in a room of heat is the inflammation. In urinary symptoms, renal and albuminuria picture is very important. Burning urination, dysuria, with stinging, urine scanty, high colored, albuminuria, nephritis, cystitis, retention in newborn. So, the last drop burns and smart. Urine may milky in hydrocephalus. In nephritic picture, nephritic cases, puffy face, edematous eyelids, scanty urine, thirstless, aggravation from heat. This is the classical picture of Apis mellifica. So, Apis in renal conditions such as acute glomerulonephritis, post-streptococcal nephritis, renal edema and proteinuria is the key action, or you may think of this pathological condition. In investigation, you may find that raised albumin urine, decreased urine output. In abdomen tight as if break, sore on pressure, dropsy, peritonitis, stool watery yellow, orange yellow, tomato sauce like. This is a important in pediatric diarrhea, tomato sauce like stools. Burning below ribs, pain going upwards from lower ribs, anus is swollen. So, acute gastroenteritis, peritonitis suspension, ascites, post-inflammatory abdominal fluid collection, think of Apis. In skin condition, urticaria and erysipelas. So, Apis is more than urticaria, still it is strong in hair, rosy red skin, large urticaria, oedematous swelling, erysipelas, carbuncle, scarlatina, burning, stinging and itching. Better by cold application and aggravation from heat. So, patient kicks the cover. This is the classical picture of urticaria. In extremity, edema and numbness, hands edematous, palms hot, feels waxy, pale and swollen, limbs heavy and numb. Hemiplegia after severe mental shock. Apis has a right-sided tendency. Symptoms go from right to left. This is a very important. So, in female, ovaries, menses and pregnancy. In you have suppressed menstruation, irritability, jealous behavior, ovarian pain, burning and stinging, aggravation from heat, better in cold application. So, ovaries numb, congested, burning, stinging pains, aggravation from caution and suppressed menses. Right ovary mostly affected. So, symptoms grow from right to left. Dysmenorrhea with scanty, slimy blood, ovarian plains, burning, stinging in the uterus. So, this is a Apis. In ovarian cyst associated with edema, right-sided pain, irritability, thirstlessness, aggravation from heat. During pregnancy, dropsy after later months, perforal convulsion, abortion in early months. So, many and women with suppressed menses and or sexual excesses. This mental physical link is important. In urinary and genital overlaps. Palpitation from scanty urine. This shows that the systemic inflammation. When the kidney are affected, circulation suffers. You may see that puffiness, edema, albuminuria and palpitation. In heart condition, heart beats, shakes whole body, stitches break down from the apex, pulse small, heart quick, mitral insufficiency, organic heart diseases. That Dr. Phatak gives the clear-cut indication. So, this is not a primary cardiac remedy. When the cardiac pathology associated with edema, scanty urine and heat aggravation. So, in congestive state of heart with edema, post-inflammatory cardiac weakness, effusion around the heart may seen in the Apis. Apis acts strongly on serous membranes, pleura, pericardium, peritoneum, meningitis, inflammation with effusion. So, in the fever state, a very good remedy in acute fever stage when there is sudden onset, burning heat, thirstlessness, want to uncover, chill alternates with heat, sweat in gushes. So, heat one part and coldness is another. Child kicks off the covers of the bed, strikes during sleep, restless but weak. Aggravation after 4 pm, don't ignore this modality. If fever is high, face is puffy, eyelid is swollen, thirstless, throats cover, aggravation from heat, amelioration from cold, think of Apis. So, too much remedy are very close to the Apis. This you may confuse with arsenic album, Cantharis, Pulsatilla. So first we may differentiate with Apis with arsenic. Apis is irritable, jealous, restless but don't demand sips. Arsenic is anxious about health, fear of death, very restless, wants company but drink small and frequent sips. In physical level, Apis is thirstless, aggravation from heat, better from cold. Here is exact opposite, intense thirst, aggravation from cold, better from warm. This is the difference alone you can save to your prescription. Another remedy is Cantharis. Both have burning, but Apis have burning, scanty urine, edema and thirstlessness. Cantharis has violent burning before, during and after urination with constant urge with intense thirst. Cantharis pain is more violent and urinary focus. Apis more is oedematous and serous. Also, another remedy is Pulsatilla. Both have thirstless, but Apis aggravation from heat, Pulsatilla aggravation from heat, but desires open air, gently, mild personality. Mentally, Apis is jealous, irritable, sharp. Pulsa is mild, gentle, weeps, seeks sympathy. Apis cries out with irritation. Pulsa cries for comfort. So, some prescribing point for Apis: sudden inflammation, burning stinging pain, edema with pupination, thirstless, aggravation from heat, better from cold application, dry sided tendency. So Phatak mentions the many remedies in the remedy relation as arsenic, arnica, helleborus, mercyananthus, natrum pulsatilla, uh, graphitis, iodum, lycopodium, stramonium, sulfur and urticarians. So, so after acute of Apis, if the deeper and chronic state appears, we may think of natrum or pulsatilla. Both follows each other. In meningitis picture, Apis leads to helleborus state in large stage of dullness. In septic stage, Apis may proceed to mercyananthus. In urticaria, Apis and urticaria urine difference is very important. Urticaria is more skin limited, Apis is systemic. So, very few pathological conditions. These are we may think for Apis is acute allergic and hypersensitivities. When there is Apis picture is red, rapid swelling, pink shiny skin, burning and stinging, aggravation from heat, better by cold and thirstlessness. So in acute urticaria, angioedema, drug reaction, insect bites, allergic conjunctivitis. So both have common capillary permeability increase, fluid leaks into the tissue, edema forms. Apis is the vascular permeability remedy. In serous membrane inflammation and effusion, so this means that you may think of meningitis. In meningia, there's pleural effusion, pericardial effusion, peritoneum ascites. So inflammation, fluid accumulation, burning stinging, heat aggravation. If there is dry inflammation, again think of Apis. In renal inflammatory stage, we may think again puffy face, swelling eyelids, scanty urine, albumin in urine, thirstlessness, aggravation of heat. So in investigation, you may see that urine albumin is increased creatinine, reduced renal urine output. So in female ovarian congestive picture, right ovary pain, burning, stinging, better by cold, jealous temperament, suppressed menses. So vascular congestion with emotional irritability. So another few remedies we may differentiate with Apis is helleborus. In meningitis early stage, shrills, Apis has shrill cry, irritability, inflammatory stage, heat. In later stage, dullness, rolling of the head, stupor, atomic motion. When there is helleborus may follow. So Another in acute condition, we may differentiate it with Belladonna. Both have acuteness, redness, but Belladonna is throbbing, dry heat, dilated pupils, intensive thirst time, congestion. While Apis is edematous, shiny, thirstless, stinging pains and better by cold. Belladonna has dry inflammation, dry congestion. Apis has watery inflammation. Another we may think of Apis versus sulfur. Sulfur has heat, yet yes, but burning souls, untidy personality, standing philosopher. In Apis, acute swelling, jealous, irritability, and thirstlessness. So, the checklist for the prescribing of Apis mellifica is any inflammatory condition with edematous tendency to fluid accumulation, burning and stinging pain, thirstlessness, better by cold, aggravation from heat, irritability and jealous mentality. In three words, we may think of swelling, swollen, stinging and thirstlessness. Apis is the remedy for acute edematous heat aggravation that reacts to the sharply demands cold. So, in OPD, day-to-day OPD, we may think of some clinical pictures in the patient. You may see that puppy face, scanty urine, thirstless and heat aggravation, think of Apis. Sudden urticaria with burning, stinging, better by cold, think of Apis. Right ovarian pain plus jealousy plus aggravation from warmth, then again think of Apis. Child with fever throws the cover, she'll cry, eyelid swelling, then think of Apis. So these are the golden combination we may think of Apis. Apis is a remedy for fluid management in the body. Fluid accumulates abnormally with inflammatory reaction. The remedies has increased vascular permeability. So stinging, swelling and better by cold. These are the Apis key indication. So this is all about Apis, a very good remedy in also in gynecological condition, ovarian pain, in ovarian tumors also, or ascites after ovarian cancer, or in the patient who have operated for ovarian cancer and then ascites is sets in. So you may observe in the clinic that patient with puffy eyelids, pink shiny swelling, irritability, throws scarf or blanket, desire for cold things and thirstlessness. So the potency selection, I use it from mother tincture to 1 m 10 m potencies. In urticaria, I prefer to use 6 potencies. In ovarian condition, I used to prescribe 30 potency. In insect bite or in acute fever, in 1 m in frequent repetition. So these are some potency selection point. So in Apis mellifica, the remedy with acute edematous heat, aggravation from heat that reacts sharply, hates warmth and thirst for air, but not for the water. So this is all about the Apis mellifica. Thank for the patience listening. We may learn the another remedy in next episode. So guys, Apis is a very big remedy, but we need to differentiate it and use it in the various condition. Mainly inflammation with fluid retention with edema is the combination for prescribing Apis with characteristic symptoms like aggravation from heat, amelioration from cold, thirstlessness, jealousy. These are the key points to the remember for prescription of the aloes. So thank you very much for patience listening. Thank you. Bye bye. Good night.